Most countries in the African region are still experiencing an increase in the number of COVID-19 cases, with some reporting cases in new geographic areas, although most countries in the region have less than 1,000 cases. We also see increasing numbers of cases in parts of Eastern Europe and Central Asia. At the same time, we're encouraged that several countries around the world are seeing positive signs. In these countries, the biggest threat now is complacency. Results from studies to see how much of the population has been exposed to the virus show that most people globally are still susceptible to infection. We continue to urge active surveillance to ensure the virus does not rebound, especially as mass gatherings of all kinds are starting to resume in some countries. WHO fully supports equality and the global movement against racism. We reject discrimination of all kinds. We encourage all those protesting around the world to do so safely. As much as possible, keep at least 1 meter from others. Clean your hands, cover your cough, and wear a mask if you attend a protest. We remind all people to stay home if you're sick and contact a healthcare provider. We also encourage countries to strengthen the fundamental public health measures that remain the basis of the response: find, isolate, test and care for every case, and trace and quarantine every contact. Contact tracing remains an essential element of the response. In some countries, there is already a strong network of health workers for polio who are now being deployed for COVID-19. Last week, we published guidance that describes how existing polio surveillance networks can be used in the COVID-19 response and outlines the measures that should be put in place to maintain an effective level of surveillance for polio. WHO has also published new guidelines on the use of digital tools for contact tracing. Many digital tools have been developed to assist with contact tracing and case identification. Some are designed for use by public health personnel, like WHO's Go Data application, which has been used successfully to trace contacts during the ongoing Ebola outbreak in DRC. Others use GPS or Bluetooth technology to identify those who may have been exposed to an infected person. And still others can be used by people to self-report signs and symptoms of COVID-19. As part of a comprehensive approach, digital contact tracing tools offer the opportunity to trace larger numbers of contacts in a shorter period of time and to provide a real-time picture of the spread of the virus. But they can also pose challenges to privacy, lead to incorrect medical advice based on self-reported symptoms, and can exclude those who do not have access to modern digital technologies. More evidence is needed about the effectiveness of these tools for contact tracing. We encourage countries to gather this evidence as they roll out these tools and to contribute that evidence to the global knowledge base. We also emphasize that digital tools do not replace the human capacity needed to do contact tracing. Starting tomorrow, WHO is convening an online consultation on contact tracing for COVID-19 to share technical and operational experience on contact tracing, including innovations in digital technology. As part of our commitment to coordinating the global response, WHO is also running the COVID-19 Partners Platform, an online tool that enables countries to match needs with resources. This online tool enables countries to enter planned activities for which they need support, and donors to match their contributions to these activities. So far, 105 national plans have been uploaded, and 56 donors have entered their contributions, totaling $3.9 billion US. The platform also includes the COVID-19 supply portal, enabling countries to request critical supplies of diagnostics, protective equipment, and other essential medical provisions. So far, WHO has shipped more than 5 million items of personal protective equipment to 110 countries. We are now in the process of shipping more than 129 million items of PPE to 126 countries. More than 6 months into this pandemic, this is not the time for any country to take its foot off the pedal. This is the time for countries to continue to work hard on the basis of science, solutions, and solidarity. I thank you.
Thank you very much, Dr. Tedros, for these opening remarks. We will open the floor now for questions. I will remind journalists to be short and have one question per person so we can take as many as possible. And to remind you that you can ask your question in one of 6 UN languages and Portuguese as well. So first question comes from NHK, a Japanese agency. We have Shoko with us. Shoko, can you hear us?
Hello, Tariq. Can you hear me?
Yes.
Okay, thank you. Thank you for taking my question. I have a question regarding the situation in Africa. Dr. Tedros, WHO Regional Director for Africa, Dr. Moeti, mentioned on 7th May that in Africa, COVID-19 won't likely spread as rapidly as other regions in the world, but it will likely smolder in transmission hotspots, and if not controlled, up to 190,000 people could die of COVID-19. Is WHO still in the same position, and what are you concerned about Africa now? Thank you.
Okay. I can begin, and Dr. Tedros may wish to comment after. I think Dr. Moeti, our regional director, was quite clear about her concerns regarding Africa a number of weeks ago, and has been very consistent in her messaging on this. There's still great concern across Africa. We thankfully have not seen a massive acceleration of cases in Africa as yet. Some of that is likely due to a lower availability of testing, but we haven't seen the hospital systems become overwhelmed. What we are seeing in some countries is an acceleration of disease. And again, we're seeing a similar acceleration in parts of South Asia, and we're seeing acceleration of disease now in Central and South America. So I think we need to be very realistic here. We're thankful for the time that the disease is not exponentially rising, because it gives a window of opportunity for preparation and to do more to prepare systems. But that is not to say that the disease cannot explode and that it cannot rise significantly in Africa and cause significant destruction and death. So with regards to the absolute numbers, it's very hard to predict what the numbers will be. What I do know is that those numbers will be lower if we have good surveillance. Those numbers will be lower if we are able to break chains of transmission. Those numbers will be lower if we can get people into healthcare, get them medical oxygen, and get them the supportive care they need. That's what I know. DG, any comment on Africa specifically? Okay.
Thank you very much, Dr. Ryan. Now we will go to Bianca Retier from Globo. Bianca.
Hi, Tarek. Can you hear me?
Yes, very well.
Thanks a lot. My question is about the official data in Brazil. Last week, the Brazilian government pushed back the release of the daily numbers for after the country's main television news program. Then it removed months of data on COVID-19 from the national website and finally released two contradictory sets of figures for cases and fatalities with totally different results, bringing further confusion. Does the WHO trust the government figures, and how concerned is the WHO with this situation in Brazil? Thanks a lot.
Our understanding is that the government in Brazil will continue to report the important figures, the daily incidence and the daily death figures, and report that in a disaggregated manner. We do have extremely detailed data from PAHO and from Brazil on the epidemic. In fact, some of the data we have from Brazil is some of the most detailed and updated on a daily basis in the world, and we truly hope that that continues. Brazil is a very large country. It has a very diverse population. It has some very vulnerable populations, particularly in peri-urban areas, indigenous populations and others. And therefore, Brazil deserves our full support, and we will continue to support Brazil and the people of Brazil in their fight against COVID. It is, though, at the same time, very important that the messages around transparency and sharing of information are consistent, and that we're able to rely on our partners in Brazil to provide that information to us, but more importantly, to people, to citizens. They need to understand what's happening, they need to understand where the virus is, they need to know how to manage the risks to them, and therefore we hope and we trust that any confusions that may exist at the moment can be resolved, and that the government of Brazil and the states in Brazil can continue to communicate in a consistent and transparent way with their own citizens in order to bring this epidemic to an end as soon as possible. We will, as I said, continue with our colleagues in PAHO to support the people of Brazil and the government of Brazil to control this disease as quickly as possible.
Next question comes from The Hill. We have Reid Wilson online. Reid?
Hi, Tarek, can you hear me?
Yes, go ahead.
Great, thanks. Does WHO continue to work with CDC, NIH, and other American institutions? Have there been any areas of cooperation or collaborative programs that have ended in recent weeks?
So thanks for that question. Absolutely. We work with U.S. colleagues, U.S. CDC, at NIH, and a number of academic institutions across the whole country in a variety of networks and different types of platforms since the beginning of this pandemic, and that will continue. We have active engagement through all of our global expert networks, which are clinicians and laboratorians and IPC specialists, risk communicators, et cetera. And so we will continue to do that as the pandemic continues.
Yeah, and may I add that it's not just in the area of COVID-19. We're already engaged very deeply and working very closely with colleagues and institutions in the US in the fight against a renewed outbreak of Ebola in DR Congo, a new emergence of a new virus as such from the forest. So managing the animal-human interface and watching out for these new diseases and responding to them in a rapid way is extremely important, and we rely heavily on our colleagues and institutions in the US like CDC, like NIH, and like the hundreds of collaborating centres that this organisation has across the United States for that scientific collaboration and that scientific innovation, and we will continue to do that until we are otherwise instructed or informed.
We will go now to Guatemala. We have Grecia online from Diario La Hora. Grecia.
Muchas gracias. ¿Cuál es la situación de Guatemala? ¿Y prevén que ya se llegó al pico de contagios, o por lo menos en Centroamérica?
I think, unfortunately, the answer to your question is no. There's been an increase, I think, of about 50% of cases in Guatemala over the last week, but a worrying increase too in the number of fatalities, which have increased by over 100%. Now, the absolute number is low, and this may reflect an improvement in surveillance. But what we're seeing from Mexico all the way through to Chile is an increasing pattern across the Americas, across Latin America, with some notable exceptions. But I think this is a time of great concern. It's a time in which we need strong government leadership in Latin America. We need strong international solidarity with the countries of Latin America, and we need leadership from within Latin America to bring this disease under control. It's not one country; it's many, many countries experiencing very severe epidemics, with what we saw in Europe and North America. Health systems now coming under real strain, intensive care beds not being available in all countries to cope with the disease, and a lot of fear and confusion at community level for different reasons. So I would say right now the epidemic in Central and South America is the most complex of all of the situations we face globally, and one in which the world needs to work and come to the support and aid of countries in the region in order to assist them in dealing with this high-impact pandemic from the perspective of Central and South America.
So, if I might add, just to say that the situation in Guatemala in the Americas is very much the current state that they're in right now is the state that many countries were in several weeks ago, several months ago. And what the DG spoke about today, very much of sort of the back to basics and back to the fundamental approach, this comprehensive approach that needs to be used to tackle this virus, is very much the same as we've been saying from the beginning. The idea that we have an entire population engaged, knowing what each individual what role each individual plays within this pandemic is fundamental. How can I protect myself from infection? How can I protect my family from infection? How can I prevent the possibility of me transmitting to someone else who may be more vulnerable? How do we have a public health infrastructure in place to be able to find cases, to isolate cases, to test cases, to care for cases in medical facilities, ensuring that they receive adequate clinical care depending on how the disease that they develop? Do we have the right workforce in place to be able to do contact tracing, to find the contacts of the known cases and quarantine those contacts? Do we have the right testing strategy? Do we have enough tests in place and enough labs to carry out those tests? Do we have this all-of-government approach, bringing in all different sectors, not just the health sector, so that we can maintain essential health services, but also try to keep other systems going? And so that comprehensive approach of what Latin America, Central America, the Americas need to focus on is very much what all countries need to focus on. And we need to remind ourselves that these interventions work. Not one intervention alone, but the combination of these interventions work. And so staying focused on that, providing the support that we can through our regional office, having the solidarity and support and getting supplies to where those are needed is really what we need to be focused on.
And Ty, could I just add, because I think it's important from the perspective of Latin America that countries in Central and South America have a hugely proud history of dealing with infectious diseases. It was this continent or subcontinent that first eradicated polio, all 3 strains. It was this continent that actually eliminated measles and offered an opportunity for global measles elimination, which we're unfortunately squandering at the moment. It was this region that dealt most effectively with the huge cholera outbreaks we had during this current pandemic of cholera, and we're still in, technically, a cholera pandemic, for those of you who aren't aware of that. So I think there are tremendous capacities in infectious disease control in Latin America and Central and South America. There's tremendous level of disaster preparedness in many countries because of the prone nature for high-impact weather events and many other natural disasters. And Central and South America have a proud history of disaster risk management, disaster preparedness, disaster response. And we need and really look to the leadership in Central and South America to leverage the undoubted scientific and public health expertise, the undoubted community levels of community power and engagement, and the energy and the innovation that's present at community level. What we hope we see is the governments of Central and South America working together to fight this disease and demonstrating to the world once again the capacity that these countries have, both in science, in public health, in disaster risk management, and their capacity to work both individually and together in a coherent way to stop infectious diseases. Central and South America have done this effectively in the past, and I have no doubt if the right approaches are taken in a well-coordinated fashion, that Latin America has the capacity to do that again.
Now we will go to China Daily. We have Chen Yuanhua online.
Hello, can you hear me?
Yes, very well.
Dr. Tedros, the Chinese government yesterday issued a white paper on fighting COVID-19, detailing all its efforts, fighting the coronavirus. I'm wondering if WHO has any comment on this. Thank you.
I can begin. I think at this point, when any country publishes an evaluation of their response, that's always a good thing to see what lessons are there to be learned. But I do think we need to focus moving forward, and it's interesting in that paper and in many other papers coming out at country level. We need to focus now on what we're doing today to prevent second peaks. We need to focus now on how we're going to prepare for later in the year. We need to focus now on supporting those countries around the world who are right in the middle of very severe epidemics that are getting worse. So I think there will be a time to go back and look at everything we've done. Everybody at every level, from global to national to subnational, from technical to political to scientific, all of the decisions, all of the actions taken at all levels by all players in this response need to be examined, and we need to learn, and we need to emerge from this pandemic stronger. But right now, we need to focus the narrative and we need to focus the discussion on what we're doing now. What are we learning moving forward? And clearly there are many positive lessons to be learned from the experience of many countries, and that's what we are focusing on right now. Learning what we can, where countries have got it right, where countries have got it wrong, and how we can find the package of interventions. What is the package? And Maria spent a few minutes earlier laying out what those activities are, and that's what we need to focus on. Does every country on this planet have the capacity to implement those core functions in terms of community education, in terms of surveillance, in terms of the healthcare system? Do we have that capacity to sustain a response against this disease until we have an effective vaccine or even beyond? And I think that's where we would like to focus. We will read the documents from China, as we do from all countries, with interest to learn lessons. But I would honestly, personally prefer if we don't constantly go back and start to re-legislate issues that have occurred months and months ago and prevent us from moving forward to do the most important work we have to do.
And I'd just like to add on the focus on the now. So as Mike was saying, we need to focus on the now. This is far from over. I know many of us would like this to be over, and I know many situations are seeing positive signs, but it is far from over. And we need to shore up our activities. We need to build up the activities in the infrastructure that is not in place in many countries and continues to not be in place in many countries. And while I don't want to focus on the negative, I want to focus on the opportunity to build this workforce build this infrastructure that isn't in place in most countries. And unfortunately, we've seen that in many countries. We're talking about the workforce of public health professionals who can carry out contact tracing. We're talking about trained medical professionals who have adequate training in respiratory diseases, specifically for COVID-19, but for infectious diseases. Looking at supplies, making sure that we have adequate personal protective equipment for every health worker on the planet that needs it. We're talking about treatments and effective, safe and effective treatments for COVID-19 and for emerging respiratory pathogens. We're talking about vaccines. So there's a lot of work that needs to be done, and we need everyone to remain focused on achieving the goal at hand, which is stopping this pandemic, which is suppressing transmission and saving lives, and there's a lot more work to do. So let's celebrate the successes that we do have, but let's remain focused on the remaining work that needs to be done, because unfortunately this is far from over.
Thank you very much. We will go now to Uganda Network Radio. We have Pamela.
All right, that brings us to the end of SA Today for today. As of course, Dr. Tedros and his team giving an update, also saying that yesterday marked World Food Safety Day, and thanking those who have continued to ensure that people can access food, safe food throughout the COVID-19 pandemic, and that WHO is proud to work with certain bodies that are making sure that indeed people are able to access food at this time. Thank you very much for staying with us on SA Today. We hand you right back to Auckland Park, where the full view begins in a short while, and certainly they will keep you updated on that WHO briefing. From me, Flo Ledwaba, and the rest of the team here in Nasrec, it's good night, and please continue